Are there any medications that don't cause drowsiness?
Any medication, and not just for ADHD, any medication, we're always weighing up what benefit is this child getting and what side effects are we experiencing, because there's no point in taking a medication that is not helping in the best interests of the child or adolescent. So stimulants are the most common medication used for ADHD, and that's because they have the best evidence, and in most cases they work the best. And we've got two stimulants on the market in Australia. There's Ritalin, otherwise known as methylphenidate, and dexamphetamine. And long-acting Ritalins are Ritalin LA and Concerta, and long-acting dexamphetamine is Vyvanse. There's also compounded versions that sometimes are made up in pharmacies. Now, stimulants in any person at too high a dose will affect them in the sense that it will make them not quite themselves. They might feel a bit flat. They might even be really out of it if the dose is too high. And those are side effects which mean that whenever we use stimulants, we always are very careful with the dose. And in most cases, in my experience, if children are drowsy because of stimulants, it's because the dose is being mismanaged or the dose is too high. So most paediatricians and psychiatrists will have a start low, go slow approach, where we start with a very small dose, even at the risk of it not doing very much for the child's ADHD. And then we will gradually increase it, watching carefully to make sure we're not changing all the wonderful things about that child and making sure they stay who they are. There are a couple of non-stimulant medications that are also used in ADHD. And really there's three common ones, I would say. There's catapress or clonidine, which can help with hyperactivity, not so much with inattention. That can cause drowsiness. There's Strattera, which is often used as an alternative to stimulants, and drowsiness can be a side effect of that. In my experience, it's quite uncommon. And then there's a new one called Intuniv or guanfacine, for which, again, sedation is the main side effect. However, it doesn't happen in all children, probably only in about half, and it does improve with time.